Today we will be demonstrating sterile dressing change for an acute surgical wound with a drain.
All right, I'm going to go ahead and verify the physician's orders. I'm going to come in the room. I'm going to provide privacy. I will introduce myself to the patient. Hello, Mr. Cutter. My name is Charlotte, and I am going to be changing your dressing on your surgical incision today. Can you tell me your name and your date of birth? And he said his name is Phil Cutter, and his date of birth is 1/1/2000. So let me explain what we're going to do. I'm going to remove the old dressing. I'm going to clean it with some wipes, and then I'm going to put a fresh dressing on there as well. I would like to know if you're having any pain at this time. And if he said yes, I would want to medicate him and give him about 30 minutes for that medicine to take effect. But Mr. Cutter said he is A-okay and we can proceed. So I will go ahead and gather my supplies. I have a biohazard bag here. I'm going to put that down here so you guys can see what I'm doing. I also have an abdominal pad, gauze sponge pads, drain sponge, and also swab sticks that will simulate a cleaning agent. I also have a measuring tool, sterile gloves. I have already pre-pulled some tape, and I put my name, date, and initials on there. And I also had 2 pair of clean gloves. So the first thing I want to do is take off the old dressing. So I'm going to put on clean gloves. Let me wash my hands. And then I'm going to put on clean gloves. Cover up the patient as much as you can, but still allow for room for you to work. All right, you're going to remove the tape using counter traction. And it's also a really good idea to, when you remove the actual dressing, to move it away from the patient's point of view, so that if it's really nasty and yucky, that he won't be seeing that or she won't. And so you want to note the old dressing or the old drainage on here. Is there a large amount, small amount, moderate amount, quarter size? What color is it? Is it thick, thin? And is there any kind of odor to it? So we're going to go ahead and fold that up and discard that. And then I'm going to remove these gloves, wash my hands again, put on fresh gloves, and then I'm going to inspect the wound. So I noticed that he has a midline incision, midline abdominal incision, and it has 6 sutures that are intact. I also noticed that he has a Jackson Pratt drain here coming out, and there's an incision around that, and I'm going to have to clean that. So I noticed that there's a little bit of redness to the midline, but the surrounding tissues are a normal skin color. There's no swelling, there's no drainage or any kind of active or any opening. I'm going to go ahead and measure the wound to make sure that it hasn't changed. I noticed that it is 7.5 centimeters in the midline incision, and then the drain incision is 3.5 centimeters. And in case I forgot, I have 6 sutures intact. Thought I said that, but anyway, we'll go on. So I've inspected, I've noted any drainage, I've measured. Now I can go ahead and remove my gloves, wash my hands again, and I'm going to set up my sterile field. So the first thing I want to do is open up the package that I will be using last. I will open up that first. So the last dressing to be applied will be the abdominal pad. So let me go ahead and open that up using sterile technique. You want to make sure that you keep that in the package. There's a little plastic tray that you can leave it in, and it'll kind of be a safe place for it. So move that away from you so that you don't cross over when you're gathering your other supplies. And then the next one I have is a gauze sponge. That'll be the next to the last thing I apply. Going to open that up. And then I'm going to move that back here. The next thing I am going to open is my swab sticks. And it helps, you can feel in there, there's some sticks. And if you can push the swab sticks so that they're as to the closest to the top as possible, so the sticks are closest to the top up here where you're going to tear it, it will help you in the long run, because you don't want to touch the stick part because that's sterile. And I'm going to show you a trick on how to get those out when you have your sterile gloves on. But the key is to make sure that you have them easily accessible. So you want them to stick out a little bit here. Okay, and then I'm going to kind of hang them over the edge of my table. Then, this is the trick part. I'm going to take my drain sponge. I'm going to open this up. Open up my sterile package. Only touching the 1-inch border. And then I'm going to position it over my swab sticks, and then I'll be able to take my sterile gloves and touch the middle of the package. Sterile to sterile, that is legal. Now I'm going to open up my gloves. I'm going to wash my hands again real quick just to make sure I'm good. You open Distal. Proximal. These gloves look like they're very wrinkled. I'm a little nervous that they're not going to stick, or that they are going to stick. Got it. Don't hesitate to come over onto the side of your table to stay away from your open sterile area. Okay, so again, I'm going to step to the side. I don't want to cross over my other sterile glove. Pinch, step back, apply my gloves without making sure that they don't touch my finger. I got 2-in-1 twins. I'm going to pull back here. My thumb is going to hitchhike. You know, we replace these gloves every year, every semester, and they still act like they haven't been touched. Now I can fix. All right. Pray you don't contaminate. All right, I don't need this, so I can move that. All right, the first thing I need to do is clean. And when I clean, I'm going to clean distal to proximal, cleanest to dirtiest. So I'm going to start with the J-tube, or the Jackson Pratt site. I'm going to put my finger here to press on the package of the sterile swab. I really need 4 swabs, so I'll have to reuse one of these. What I'm going to do is I'm going to make a C. So I'm going to kind of go on that side. I'm just going to kind of roll as I make a backward C. And I just kind of want to make a little circle. And then I'm going to throw away my swab stick without contaminating or crossing over. I'm going to go ahead and get the next one. I'm going to go again to the proximal side of the incision. I'm just going to kind of roll as I swipe one time down. I'm going to discard that one, get another one out. I'm going to go right down the center of the incision. Again, I just roll as I go. Discard that. Did you all notice what I just did there? Anyone catch it? I went like this, which is a big no-no. So I crossed over or under, so we need to make sure that it's best if you do this and then switch over. So, see, we all make mistakes. All right, then we're gonna go to the proximal side, and again, just scroll down like that. Throw that away. Now I'm going to apply my drain sponges. I'm gonna take one out. The most important thing, again, I wanna make sure that I do my best to go around that drain, and the center part is what we wanna keep. We want it all sterile, but we're gonna just kind of wrap it around there, leave it where it may. And then you're gonna take the other one, and we're just going to kind of wrap that around and drop that as well. If it's not perfect, don't worry about it. Then I'm gonna take my gauze, there's 2 of them here, and this is gonna go over the main line or midline incision. It's already kind of covered, but we're gonna give it a little bit of extra padding. And then I'm going to take my abdominal dressing pad, and at this point everything is covered, but we're just going to touch the outside portion here. And you can go this way or that way. I like to go this, it kind of covers a little bit more. Cover that, and then I'm going to take my tape, I'm going to go right down the center. Go at the top, and then at the bottom I'm going to create a little tiny bit of a little smiley face because we don't want to get any pubic hair in there, so we're just going to get a little smile. All right, and then I'm going to document that I performed a sterile dressing change. I'm going to document that I used, or what I saw on the old dressing. I'm going to document what I saw on the incision and the drain site. I will also document what I cleansed it with, and then the supplies that I used as well. And then I would make sure that my patient is comfortable, bed in low position, wash my hands, all of that. And that concludes sterile dressing change.